जय झूलेलाल, जय झूलेलाल ऐं सभिनीनि खे नमस्ते। सभिनीनि खे हैप्पी न्यू 2022 कैलेंडर ईयर। ही नओं अंग्रेज़ी साल असांजो पहिरियों एपिसोड असां तव्हां सभिनीनि जो वेलकम था कयूं। वी वेलकम यू ऑल इन 2022। सिंधी हेरिटेज फाउंडेशन एंड श्री दयाल एंड हरजानी पेश कर रहे हैं संस्कार। संस्कार आज का हमारा स्पेशल एपिसोड है आयुर्वेद के ऊपर। आज के हमारे मुख्य मेहमान हमारे बीच में हैं डॉक्टर R.K. मामगेन एंड डॉक्टर प्रतिभा मामगेन। मैं रिक्वेस्ट करूंगा कि उनको हम स्क्रीन पे लाएं। डॉक्टर R.K. मामगेन एंड डॉक्टर प्रतिभा मामगेन। नमस्कार, हरिओम।
नमस्कार, हरिओम, जय झूलेलाल।
झूलेलाल, आपका हम हार्दिक स्वागत करते हैं। डॉक्टर राजकुमार जी एंड डॉक्टर प्रतिभा मामगेन दोनों BA MS फ्रॉम लखनऊ पास है और इन्होंने PhD की है एक ऐसी यूनिवर्सिटी जो विश्व विख्यात है, जिसको हम बनारस हिंदू यूनिवर्सिटी के नाम से पहचानते हैं। डॉक्टर मामगेन जी ने WHO के लिए भी काम किया है और उसके अलावा वे त्रिभुवन यूनिवर्सिटी काठमांडू में भी काम कर चुके हैं। आज हमारे बीच इतने एक्सपीरियंस होल्डर जो आयुर्वेदिक के एक ज्ञाता है, मैं इन दोनों डॉक्टर प्रतिभा जी और डॉक्टर R.K. मामगेन का एक बार फिर से स्वागत करता हूँ। स्वागतम।
थैंक यू वेरी मच।
मैं हमारे इस शो के को ऑर्गेनाइजर एंड स्पॉन्सर दादा दयाल एंड हरजानी जी अगर उपस्थित है तो मैं उनको भी आमंत्रित दूंगा।
नमस्ते नमस्ते दादू जैन जी।
नमस्ते रविंद्र जी, कैसे हो? दिल से स्वागत। Nice to see both of
Thank
you
you.
sitting under
Thank
one
you.
camera. So we are going to have a very interesting program. Now, it is our tradition to welcome the guest with a little doha or a poem from Dadu's collections. So I've selected one for the viewers and as well as for you. It says, सारी उम्र किया मैं और मेरा, सारी उम्र किया मैं और मेरा, फिर भी रहा कुछ नहीं तेरा, फिर भी रहा कुछ नहीं तेरा। गुरु नानक बाजार में कहे यह तेरा तेरा तेरा, ईश्वर गले के लगा से फिर बोले तू मेरा मेरा मेरा। So the meaning of this is all our life we say this is mine, me, mine, mine, but nothing remains yours or as such. But when Guru Nanak Das went in the market to sell something, I lost you guys, yeah?
आज हम आगे बढ़े उससे पहले मैं प्रदीप को बोलूंगा कि एक पोस्टर जो मदर अर्थ के लिए दादू जैन जी ने निकाला है वो पोस्टर दिखाया जाए, तो उसके बारे में मैं दादाजी से रिक्वेस्ट करूंगा कि वो रोशनी करें।
So when Guru Nanak started saying ye tera tera tera, Ishwar heard his prayer and said, now you are mine, tu mera mera mera. So there's a big moral in this story or in this poem. Now, before we start the dialogue of question and answers, we are in the midst of our program of World Mission with a World Vision, which talks about spiritual self-quarantine for world for One Destiny, One World. I'm sure you must have received that brochure. I think Narayan, you sent to the...
प्रदीप वो पोस्टर देखा ना जेको दादा जो right.
Did you receive this? I'm sure
Yes,
many
we
of
have
you
received
must
it.
have received this, and this is a call to the whole world to abstain from meat and alcohol for this 1 week as a penance or a sacrifice for appeasing the nature and providence to be more kind on us. We are having so many problems and natural disasters. So these are all reactions of the collective consciousness of the people. So in order to purify ourselves, a thought came to me, and then this is the result of this particular thought seed that took place. So I have a poem. It's called A Week for the Week. A Week for the Week. And it goes like this. The media sensationally ripe. It is time for us to take a swipe. The stars and planets store at Earth's plight, millions sacrificed in their astral sight. What about their pains and cries? Will such stain in calamity strike on our lives? The dumb unable to speak, mercilessly chopped as consciously weak? Should we be aware of nature's wrath? 'Tis time to clear Earth's karmic path. The future seems unnatural and scary. Our souls are in dilemma, doubt and weary. Should we appease and atone to the merciful gods in humble submission and heavenly nod? Is peace the monopoly of world leaders, our own conscience the divine pleader? 'Tis also a matter of buds of taste that lure and justify the satanic haste. Can we resolve to preempt clear and loud and spread this message to the billions with the speed of iCloud? And with this little poem, which I hope will strike into everybody's hearts, we will request our speakers, our panel speakers to come on board, please.
I request Malini, Hemlani,
And now
Diva.
Diva and Malini, welcome both of you.
Namaste.
Namaste.
Yes,
Ji.
very clear. Jai Julelal. Namaste to
Jai
everybody.
Julelal.
Jai Julelal,
No.
Jai Julelal.
I would like to introduce both of you, you lovely soul personalities. Diva is a counselor in psychology. She's a wellness therapist, yoga therapist, and dance movement therapist, and many, many more. I mean, if I would go on, I think the show would end here only, praising this lovely girl. And so also
Thank
with
you.
Malini. Malini is an adept at hypnotherapy and specializes in healing physical and psychological ailments. And she's a master adept in hypnotherapy and Ashtanga yoga. And her accomplishments are also so many that I've got a little inferiority complex.
Oh, please. Thank you. Thank you.
Multi-talented
Appreciate
lady.
your kind words.
And then I'm just kidding, joking. God bless you both. Now,
Thank
I
you.
understand there are some Japanese viewers also. Ravindraji, is it true?
Yes, I have sent the link to many people, so I hope so. People must be watching this.
So now our dear Diva is in Japan. So I will request Diva to welcome the Japanese viewers and welcome them with a Happy New Year and welcome to the show in Japanese.
My honor.
Okay, great.
皆
Go
さん
ahead.
Thank you. 皆さん、ようこそここへくださって本当にありがとうございます。明けまして本当に ありがとうございました。今晩の学ぶべきたくさんの新しいことを習います。本当にワクワクですから、どうぞお楽しみください。
Very good.
So
Lovely.
nice.
Fantastic.
Welcome to our friend.
Now I understand we have Chinese from mainland China also.
Yes. I have sent the links to the Chinese,
So
many Chinese. I hope
will
so.
welcome them in Putonghua. Okay.
Now, I request Diva and Malini ji to take the questions from.
Okay, so meanwhile, I'll just take Dadu's place for a minute and say, Ni hao Pangyao. Okay, Dadu, I'll let you take over.
Okay. How's that? Nishaman, her Shanshaman. Shinyan Huaile. Huayin Lai Dao Woman the Jiemu. Qing Xian Shou. Please enjoy. I welcome all the Chinese people into our show. Now, we will give the floor to Malini to ask your first question, and then Divya will continue with the next first question, and we'll keep on and see how the time flows. So, Malini,
Welcome, Dr. G. First of all, Happy New Year and
Thank you.
बहुत अच्छा लगा आपसे मिलके and इतनी wide audience है कि हम languages mix करके बात कर सकते हैं तो बहुत अच्छा लग रहा है हिंदी बात करके हांगकांग में रह के तो जैसे हम एक मॉडर्न सोसाइटी में रहते हैं खास करके जैसे हांगकांग सिटी है या जैसे डीवा जापान में है तो कुछ भी होता है तो हम डायरेक्टली मॉडर्न मेडिसिन पे जाते हैं हम एक बार भी नहीं सोचते और पैनाडोल पॉप अप कर लेते अगर हेडेक होता है तो मुझे ये पूछना था कि पहली बार आयुर्वेदा है क्या और वो मॉडर्न मेडिसिन से कितनी अलग है या सेम है लाइक व्हाट इज द डिफरेंट हाउ इज इट डिफरेंट फ्रॉम मॉडर्न मेडिसिन एंड व्हाट एग्जैक्टली इज आयुर्वेदा
Yeah. So as the word Ayurveda says, it is made of two words, Ayu, that is life, and Veda, the science. So Ayurveda is science of life. So it has two objectives, and that makes it special. It has maintenance of health or prevention of disease, which is a specialty of Ayurveda. And also, if somebody is sick, then also it tells about the cure of the disease. That is very special about the Ayurveda. So if you want to see an Ayurvedic doctor, it is not necessary that you have to be sick. Even the healthy people can also consult Ayurvedic doctor because there is a saying in Ayurveda that if you fall sick, then you suffer. You have to spend your money. But even if you get well, still the memory of that pain, that difficult time, stays with you. So it's not very good to fall sick. And so Ayurveda emphasizes to maintain health. If you are healthy, still how you can maintain your health, that is very important. But if you are sick, then it tells about the cure. Various type of diseases can be treated with Ayurveda. Also, Ayurveda uses natural things, whatever is available in the nature, whether it is plant, which is used mainly, or minerals, metals, or the products of animal origin, can be used in Ayurveda. So, because we are also part of nature, we are nature. So, the other things which are also from the nature are good for us, and our body accepts these things very comfortably. So that's why Ayurveda is very special. While if it comes up, as you are asking, how it is different from modern medicine, the modern medicine depends on the synthetic medicine, or what it does, it takes separately an active compound from the, if it is using a plant, then what it does, it separates an active compound, active component and uses it. So it is different. But also the approach of modern medicine or allopathy is strong. And because these medicines are chemical medicines, so our body sometimes reacts to these things and produces many side effects. So that is different. You can say modern medicine has little aggressive approach, while Ayurveda is mild in nature and acceptable easily. So that makes it different. Also, Ayurveda see a person as a complete whole. Ayurveda is holistic, so it
Right.
looks a person in complete totality. If a person who is having a problem, or even if a person is healthy, approaching
Right.
an Ayurvedic doctor, then the Ayurvedic doctor will see the mind, the body, also the emotion, everything, and to
Oh,
understand the
that's
root cause.
right.
Yeah. So
That's
Ayurveda doctor
lovely
will
to
go,
know. Yeah. Yeah.
yeah, to the root cause.
Mm-hmm.
So when you will approach with a kind of symptom, doctor
Mm-hmm.
will not see the symptom only, but rather Ayurvedic doctor will try to understand what is the root cause and where it is situated, whether it is in your emotion or in your mind, or it is because of the wrong lifestyle or diet. So it's not like you are coming and there is a symptom and Ayurvedic doctor will give a medicine. No. Usually in the modern medicine or allopathy, they
Right.
treat your symptom, but Ayurveda treat you as holistic person in a whole, means everything is important in Ayurveda.
Right. That's lovely to know, doctor, because I mean, even in hypnotherapy, we work directly on the mind, and very beautifully you put it that the root cause, because root cause is essential to know, and that's where it can be worked on. So, coming back to my next question is, what all can be treated with Ayurveda? What does it work on? Like emotional
Let,
issues, physical issues, any diseases?
let the second question come from Diva, and then you can continue alternatively.
Actually, we decided to do 4 and 4.
4 and 4? Okay.
Yes. Yeah.
Okay, then you all decide. It's
Yeah.
okay. Yeah, okay. Go
So
ahead.
while, yeah,
Yeah, go ahead, Malini.
I asked my question. So, like,
yeah.
what my question? Yeah,
So,
what can be
so
treated?
yeah. Thank you, Malini ji. Ayurveda can treat most of the diseases. Only those diseases which are treatable with the surgery or acute infections cannot be treated with the Ayurveda because it has mild nature. But most of the chronic diseases, mild diseases, lifestyle disorders, everything can be treated with the Ayurveda. You go from head to toe, like say headache, many allergies of respiratory system, bronchial asthma, digestive disorders, or disorders of like say muscles, joints, nervous system. All these kind of diseases are treatable with the Ayurveda. So there is a wide range of treatment with the
That's
Ayurveda.
lovely. So, how do you do the diagnosis, doctor?
Yeah. So diagnosis is very important. Uh, if you say when we see a patient, we see the patient, the inspection, which we say as darshan, then sparshan, which is like palpation. So we palpate, we touch the patient, and we see various part of the body. If a person is complaining about some problem in the like say breast, we have to examine that. Otherwise, we say that the abdomen is a magic box. So many organs in the abdomen. So we do palpation of abdomen, and then we ask a question. So this is one approach: darshan, sparshan, and prashna. But when we elaborate it, there is another examination which we say eightfold examination. So nadi or pulse, jiva or tongue, malam or the feces examination, mutram or the urine examination, shabd. So we have to hear how you are talking, but also we can hear many other kind of sound which body is producing. Like sometime abdomen is producing some sound. So sab, shabd, sparsh, then we touch. we touch, we see the temperature. And also palpation comes under this. Drik, eyes are very important and tells about many things. Then the akriti, how is your decubitus? How you are sitting, how you are entering in the room, how you are showing, like many times posture is very important. Even seeing the posture, you can understand where the problem is. So that is one approach. Then coming to the patient, patient is very important. And when we are giving a dose of the medicine, we have to understand what kind of patient we are treating, because in Ayurveda, every individual is different. Everybody is not same. So we believe in constitution, physical constitution, and there are many types of physical constitution. Depends on the baat, pitta, and kapha, which are the neurohumors. So first we see what kind of constitution is, and then we see the vikrati or the pathology. This person is having what kind of pathology? Then SAR. So what kind of body tissues? Because there are 7 body tissues, and we have to understand whether these body tissues are normal in the condition or good condition or are not proper. Then samgnan or the compactness of the body, which is very important, because compactness also tells about what kind of fat you have or not have. So it also tells about the exercises. If your body is compact, that is a good body.
Right.
So, and then we have to understand praman. Praman is proportion of the body. So if the body is proportionate, it's a good body. Or if a body is not proportionate, it also tells about many disorders. Then sattva. Sattva is so important. It is mind. So a human being, what kind of mind a person is having, it can influence the disease or health. So there are various type of people. Some people have little disease, but they are hypochondriac. They show like they are very, very sick. And when we have to give medicine to them, we have to understand that person is not much sick and maybe is showing more disease or is showing like he is seriously sick. So we cannot give a strong medication. We have to understand that this person need only mild medication or maybe some counseling. Some people have medium kind of mind or madhyam sattva. Some people have pravar sattva. Pravar means a strong mind. So, or good mind. They have a strong willpower. We have to understand them also, because they may be very much sick, but maybe they are not showing. They will say, oh, I'm okay, but maybe they are suffering and they may need more medication in number or maybe in the dose. So that is very, very important. Then we have to understand adaptability. If we are prescribing diet or medicine or lifestyle, we have to understand what kind of things can be good for this person, what kind of person this person can adopt. So some people have allergy to some food. So if that thing is not sath mein or not adaptable to that person, then we can give that. Also, we have to understand ahar shakti, how much this person can eat, how much this person can ingest, how is the appetite. Because if you are prescribing a balanced diet, still you have to understand about the amount, what kind of, how much amount will be okay for this person. And then we have to consider Vyayam Shakti also, because exercise is equally important. But if you are prescribing exercise to a person, you have to understand this person can do this much of exercise. This person should not be like a heart patient or something. So all these factors are very, very important. Then coming to disease. So we have to understand disease. And disease we understand with the causative factor. So we ask what happened, what you were doing. So to understand what can be the causative factor of the disease, then we understand about if there was some symptom before the appearance of the disease. if there were some symptom, because that also help in the diagnosis.
Right.
Like in case of jaundice, people have loss of appetite. So that can be a symptom before the appearance of the disease. And then we have to understand what are the sign and symptom. So that, and when we give medicine, sometimes we understand if that medicine is helping, then we can understand, okay, this is the right thing, right medicine, and this is the disease, it can be cured. And
Wow,
also
that's
we
amazing.
understand pathogenesis of the disease.
Right.
So many factors, because we have to break the pathogenesis of the disease
Get it.
to cure the person. So you can understand that it's very
Lovely,
wide.
Dr. Prathibha. Yeah.
Malini, I have a question for Prathibha. So
Yes.
when you're diagnosing a patient, how many
Yeah.
criterions, how many points do you have a list, bullet points of the criterions that you're going to check, or what? How do you go about doing that? How many criterions do you really take into consideration to diagnose a person?
So all these criteria are considered about the examination of the patient, about the examination of the
So how many
disease.
are there? Total, how many are there in number? And have you
So
counted?
if you are talking about the patient examination, these are 10.
10 basic.
Okay.
Yeah, these
Okay.
are 10 in number.
Yeah.
Which then
So that's lovely to, yeah.
which you can evaluate the person's disease or condition and depth.
Yes.
Okay.
Yeah.
Malini, you're
So this
on.
is a good combination, I think, of a mind and body. So basically, it also means that to get your mind and body in sync, which is actually the goal of wellness. So my last question to you, doctor, would be: is that you have explained such amazing and points about Ayurveda. Is that the reason why it's globally getting so popular now? People are switching in and making a conscious decision then over modern medicine.
Yeah. I will say that, yeah, modern medicine is also important, but now worldwide consumer is looking for the broader aspect of healing, because many times you don't need strong medication. You don't need allopathic medicine. There are so much stronger side effect of the allopathic medicine. Sometimes you are taking a pill for headache. It can cause blisters in the tongue or in the throat, or it can damage sometime liver if you are taking it means many times.
Right.
If you are using these medicines, so a simple medicine for simple disease can be very harmful sometimes. And now worldwide people are very much like say very much intelligent, many intelligent people, and they are reading, they are understanding the thing, and they want safe medication, whatever
Right.
is safe. So I had a client, and that client was telling it is a crime to fall sick. So also people want to stay healthy, because they
Right.
say, yeah, it is very important that we should be self-dependent. We should not be dependent on other. And Ayurveda is teaching you that if you are healthy, how you can stay healthy. That is so important. So that's why
Correct.
many people are looking for Ayurveda, because it is telling you how you can stay healthy, how you can maintain your health, how you can live long for 100 years with your sensory organs working perfectly. So it is
Right.
beautiful. But also
Right.
Ayurveda is user friendly, because it is derived from natural substances, and that is very important. As I told, that we are nature. So any natural things is very much acceptable to our body and our mind, and we feel comfortable when we use any natural resource or natural medicine. But chemicals with so many side effects, and we don't know what will happen later on also, because many medicines which we use now can change some system, and we may experience that problem or any change in the system maybe after many years. So now people think, okay, it is not necessary to take very strong medication. because many times you are using an antibiotic, for example, now,
Correct.
and
Yeah.
that is tested in the lab, and they say it is safe to use, and it comes to market. But
Right.
after a consumer is using it, like say case of tetracycline, which people were using before, later on people came to know that it is affecting your bones, affecting your
Right.
teeth. But it came after so many researches. So now people have this fear that even if a drug is coming after so much lab testing in the market, you never know how the body will react to this. So that is a kind of fear. And so if something is treatable with the mild medicine, people prefer that. Also,
Correct.
Ayurveda is less expensive if you compare to the cost of modern medicine. Ayurveda is
Oh,
less
yes.
expensive.
Absolutely.
If people can identify herb, many herbs are available in the nature. It is free. You can get it from the nature. So these
Doctor
kind of things.
Dr. Prathibha, thank you. Just want to interrupt you. Sorry for that
It's
statement
okay.
you just said. Thank you, Malini. As you explained to Malini just a while ago, some of the side effects of synthetic medicine are that the chemicals stay in our body for quite some time, and some of our viewers who may be beginners to Ayurveda, they come across a lot of Ayurvedic products in the market. We have some stores that claim they have Ayurvedic products and they sell it over the counter. So, as you explained rightfully, Ayurveda, the beauty of Ayurveda is that it is catered to each person, their individual needs, and you detect the 10 points of each patient and then prescribe the Ayurvedic medicine. But if we buy over-the-counter Ayurvedic products, is there any side effect to that our
Yes,
viewers should know about?
yes. Actually, if you are using any medicine, it's better to consult an Ayurvedic physician. As I told you, all the medicines which are over the counter, even if they are claiming these are Ayurvedic and safe, you don't know whether it will be appropriate for you or not. So it is always good to consider a consultation with the Ayurvedic doctor, because every human being is not same. If you
Absolutely.
understand about the Panch Mahabhut or the five basic elements, these made
Mm-hmm.
our body, and every individual have different proportion of these elements. Also, as I told you about the vikrati or the pathology is different in everybody. So many other factors. So how an over the counter drug can be used similarly in every person? That is
Exactly.
actually the allopathic medicine. Allopathic medicine, like you can use same pill for the headache for everybody, but it is not the case in Ayurvedic herbs or Ayurvedic medicine. So that can be a selling strategy, because people want to sell over the counter drug to increase their sale. But it is always appreciable if you consult an Ayurvedic doctor to understand whether this medicine is okay for you or not, because it cannot be beneficial if you are using it just because of the advertisement or if somebody is claiming. And many
So
times there are synthetic mixture also in these medicine, you don't know.
I see. So it's not purely, so the different degrees you're saying, Dr. Pratibha, of Ayurvedic consistency, you're saying that it could be mixed with synthetic products if it's sold over the counter. Um, or is there, like, for example, if the person is taking an Ayurvedic skin product, it could be mixed with a
Yes,
synthetic chemical inside it.
yeah,
But if,
yeah.
because it says Ayurveda on the packaging, does that mean that if there is a side effect from taking that medication, that side effect will be less than taking than using another allopathic product? Is that what it is, or is
No,
there no differentiation whatsoever?
so usually Ayurvedic medicines don't have side effect. These
Yes.
are very
Mm-hmm.
safe to use, but still if there is a possibility because of some constitution, because there are some herbs which are pitta dominant, and if we are using this to a pitta dominant person, then we suggest to them some drink or something to mix with it. We call it anupan. Like certain medication should be taken with the honey or with the milk
Right.
or sometime with the ghee. So it is always good to consult a doctor because you don't know what kind of person you are.
Divya,
And
I'll interrupt 1 minute.
sure.
Prathibha, you are saying go to a doctor, Ayurvedic doctor. What is the qualification of a doctor, Ayurvedic doctor?
Okay. So we have an organization like in India, we have organization which controls quality of the doctor, and a person should be registered with that institution. So it is not like this that somebody is studying online for a few months or just by reading books, and they should not actually allowed to practice. So you should know that you should go to a registered medical practitioner, registered Ayurvedic medical practitioners, those people who have done proper course. Like in India, we have a graduate course which is 5.5 year long. So 5.5 year long course. And like we have done a postgraduate course which was 3 years from Banaras Hindu University. Then we did research. But even if you are going to an Ayurvedic doctor, that doctor should have a proper license, at least 5.5 year degree course, so that we call it BAMS,
I see.
Bachelor of Ayurvedic Medicine. So a person should be qualified. Nowadays, many people are claiming that Ayurvedic doctors, and people don't know if they are really
That,
qualified or not.
that's
So
why I asked you that particular question. I
yes,
think Mr. Narayan wants to ask you one question. Please,
sure.
Narayanji, please ask one the question Geeta
Can
wants to
I,
know.
yeah, can Ayurveda also cure for the dialysis patients?
Actually, Ayurveda can support in those cases who are on dialysis because every pathy has its limitation. And as I told you, that those diseases which are acute in nature. So if kidney is so much damaged that a person is needing dialysis, so who are qualified doctor, will not claim like this that we can cure you completely or you will not need dialysis. But still, we suggest some Ayurvedic herbs which are very good for the kidney and have supportive role. So that can reduce need of dialysis. So maybe if somebody is going like say every third day for the dialysis, maybe that person will require to go on fourth day. So here Ayurveda will have supportive role because kidney is so much damaged that you cannot say that now after so many years when you have not taken any help from even Ayurveda or the lifestyle was not good or because of any other reason, if it is because when the condition of dialysis comes, when the kidney is working like very very little, like say 20% or less, so at that stage you contact your allopathic doctor, take the dialysis, but Ayurveda can be taken for the support.
Thank you.
Okay, now you are happy.
Yes,
Narayanji,
because
we
my wife has avoided, I think, dialysis for 10 years with support of yoga. But in last, we have to go for the transplant of kidney.
Yeah, yeah. This happens, yeah.
Yes.
Ayurveda, yoga, all are very sister branches, and yoga, yeah, yoga is so important. So that is very good. That is very good that your wife tried for yoga and could, means so many years can stay healthy. That is very good to know.
okay, Diva, you're on. Your next
Thank you.
question.
Yes, regarding what are the methods of treatments for Ayurveda, I have a specific question from you, doctor. You said that for example, posture. One of the things you look at is posture of a patient. And that's something that not a lot of treatments refer to. And I think that makes Ayurveda very unique. Could you tell some of our viewers what, some of the points you look at when you're looking at someone's posture? And I think it's a very important thing to think about, because as a yoga teacher, I come across a lot of students, a lot of children and teenagers who are already having surgeries done on their backs and stooping because of the heavy bags. And as we know, thanks to COVID, there's been a lot of online learning. So they're stooping and watching the screen all the time. And unfortunately, there's a lot of neck ache and backache. And we know, as practitioners and healers, we all know that this is very foreboding for the future generation. So if you could explain the significance of a spine and also postures, that would be wonderful. Doctor.
Yeah, it is very important because it should be in the alignment. If somebody is using even the computer, there should be limited hours. If it is not necessary, not too much use of phone or computer, because many times children, as you said, teenagers, they are using too much of a phone, mobile phone and the laptop, and sometimes it is not necessary, and they forget about the exercise or about the reverse posture, which you yoga teachers teach them, that most of the time if they are bending their shoulders towards the front of a computer, there should be some reverse postures also, which are so important. Like maybe you are telling them cobra pose or grasshoppers, locust pose, those kind of things. Also, when they are sitting, because now so much time people are sitting on the chair, and you will surprise. Last week we were treating a doctor, a medical doctor. She is an anesthesiologist from a very reputed organization, All India Institute of Medical Sciences. We were doing panchkarma of that doctor, and she's only 31 years old. And doctors prescribed her surgery because she has problem in the lower spine and the sacrum. Most of the time, because of maybe she was studying, but even in the study, probably she was not knowing what is the right posture. So she had sacralization of lumbar vertebrae, means her lumbar 5 was joined with the sacrum. And also so many changes in the disc. Disc was bulging and pinching of nerves. Why? Because of the wrong posture only. And I'm happy that she got benefit, and now the surgery is will not be done. I hope she will stay healthy. But if somebody has told her that how the posture should be good when she is studying, because she is such a brilliant doctor, probably she might not have this problem. Just recently married, and if somebody tell you need an operation, that is so awful. So posture is very, very important. Yes.
And not just physically, but could you tell our viewers how it affects the mindset as well?
Diva?
Yes.
Diva? I think it's time for Ravindra to come on the
Yes,
arena.
yes, yes.
He's been
Yeah.
very quiet.
Maybe change.
मेरे को तो उपवास है, पर आपको भी उपवास है क्या आज? Welcome, Ravindra ji. Good to see you.
Thank you, sir. Thank you.
Let Divya position her questions to you, and after that, I'll take you on. I'll ask you the questions. Diva,
Thank
please
you.
go ahead.
We are so happy and feeling so comfortable, just like talking to the family. I'm thinking that I'm right now in Hong Kong.
Correct. You are most welcome. Diva, please continue.
Yes. So Dr. Ravindra, just reiterate the question. Actually, this is not just for our younger generation, but also for a lot of adults. What are the preventive measures that we can take when you observe somebody's posture? One of the side effects mentioned by Dr. Prathibha is the discs fusing into each other and the vertebrae disjoining and all that, which can be physically painful. But also, how can we make sure that we prevent any issues happening to the mindset of the person? Because it's such a huge epidemic that's taking place. So just your take from the Ayurvedic and holistic view.
Yeah. So as we know that, you see, most of these kind of health issues, they are basically related to lifestyle related disorders, no? Like we are talking about the posture and our lifestyle. We are creating these kind of diseases. Actually, we can definitely we can prevent them. Depending upon that, you need some sort of very basic education about all these things from very beginning, from the childhood. If you talk about all these gadgets, whatever we are using, even the children, they are using from very early age. We are very happy that, you see, now yoga has worldwide so popular, and people almost, if not the complete family, but some of the members in the family are definitely practicing yoga. So that can be a motivation for these people, no? So as far as the posture is concerned, I think yoga can play a very important role in that. When we are talking about the Ayurvedic treatment, Ayurveda and yoga, they are very sister sciences, no? And when we talk about a comprehensive way, what is the Ayurvedic treatment? Then we talk about Aushadhi, there must be some drug, Ahara, your food, and Bihara, your lifestyle. And that incorporates all the yoga also into that, no? So this is a combination of all these three. You cannot treat the person simply by the Aushadhi, by the drug. That is equally important, as well as the Bihara, your lifestyle, and yoga can play a very important role in that. As far as if the situation is already created, as Dr. Prathibha said, then definitely we have a very special treatment for that. Along with yoga, or the people are going for physiotherapy, Panchkarma or some Ayurvedic therapies, they are very specific for that. Even if you are not going to detox or the complete Panchkarma, if you are doing some sort of external therapies, very simple therapies in the form of massage, or we call like Kativasti, putting some hot oil on the back, or treating that particular organ. If you have a knee joint problem, then you can treat particularly with the hot oil that knee joint or shoulder joint, like frozen shoulder. It has a very good effect. The people get instant relief after 2-3 days of the therapy. And most of the such situations we encounter in our day-to-day practice, that orthopedic surgeon used to tell them, now you have to go for the knee replacement. No doubt, if the condition is so worse, you may need the knee replacement, but it is good if you can delay it. That is the last option. So if you can do these kind of therapies, physiotherapy, yoga, and some Ayurvedic therapies with some medicated oils, you can get a lot of benefits out of that. So we need to consider all these things in a very comprehensive way, in a very integrated way. Ultimate aim of the doctor or physician is to improve, to give relief to the patient.
Absolutely.
So we should be a little open, welcoming everything which really can give benefit to the patient. So we should apply some integrated approach for that. And then I will say that for the musculoskeletal problem, as far as the posture and musculoskeletal problems are concerned, Ayurveda and yoga is the best answer for that.
Beautiful. Thank you, doctor.
Diva, any more questions you have?
No, I think Malini has something to say.
Okay, Malini. Can't hear.
Yeah. So my question is actually diet based. So coming back again to the modern lifestyle these days, you see everybody is turning vegan due to like health issues or for whatever. And over here, Dr. Prathibha just said about milks, how some medicines can be mixed with milk or honey, or for that matter, ghee. So we all know that milk has tryptophan, which is very soothing and relaxing, because in the night in India, you know, we drink haldi ka doodh. Or for that matter, ghee. Ghee is very good for our buddhi. So this is what our elders used to give us. So in today's times, what would you like to tell people who are turning vegan, and they are all like are the health conscious or diet conscious, thinking that ghee has a lot of calories and they are like refraining from using it. So what is your take on that, doctor?
Okay, so I'm not saying that people want to vegan, it is not good. I should not say like this. But I can see one thing. You see, say you one thing. Anything, if you are doing something extreme, is not good for your health. So this is a very common. Moderation is the key of success. Moderation is the key for the good health also. So if you are really keeping yourself like vegan, then what actually happen? You are restricting yourself to many of the nutrients. You understand? Many of the nutrients. So I think so. It is good to have a very balanced food. So people who are vegan, they might have some sort of problems in the long run. It is their choice. But as far as the Ayurveda is concerned, we consider, you see, milk is such a thing that when the baby born, 6 months, he is entirely on the milk. So you can understand that everything is within that. He don't need any other kind of food. He can develop bones, muscles, and every organs of the body from out of that milk. So it is good to follow the moderation in the life. As far as the non-vegetarian are concerned, you understand, we have a substitute for that, no doubt. Like if you talk about the animal protein, is supposed to be the best protein, but if you talk about the lentils and beans, they are not less than that. So we have options. So it is good to have a very balanced diet. And as far as the Ayurveda is concerned, no, because we have a very different perspective to understand the diet. It is not like fat, protein, carbohydrates, minerals, vitamins. We just talk about the 6 different kind of taste, like sweet, sour, salty, and bitter, astringent, and pungent. So our diet, or whatever we are suggesting to the person, according to the constitution, we consider all these 6 kind of taste, and according to that, we allow him that this diet may be more suitable to you. So what I should say, that it is good, their personal choice, they want to be vegan, but I think so, milk itself has a life. In Ayurveda, in Charak Samhita, it is said to be Jeevaniya. It is a complete food, complete food. So it is good to take milk. Like you said, given the example, you see, if you are not having a good sleep in the night, you can have a glass of milk. It can induce a good sleep. If you are making it a golden milk, mixing it with the turmeric, you can get rid of a lot of some inflammatory process, whatever is going on inside the body, it can help you in that.
Okay, Malini,
Yeah.
Diva, you're through with your questions? Sure. Okay, so I'll continue. Ravindra ji, ek
Haan
baat
ji.
hai. When Ayurveda started thousands of years ago, right? How many thousand
Yeah.
years ago you can
Yeah.
recall?
Yeah.
How many? 3,000, 4,000, 5,000 years back?
You see, if you see the history and all that, so most of the time you can find in the books like 5,000 years old.
Okay. So
It has,
it
yeah,
started with basically panchakarma and herbal medicines, and natural therapy part of this Ayurveda or no?
yes, yes. So history goes back to the Vedas. You understand? You can find the description of all these herbs in the Atharva Veda. And then later on it came. You see, there is a very interesting history that it started. The Brahma created first Ayurveda, and then it has come to the Daksha Prajapati, the another god, then came to the Aswini Kumar, which is supposed to be the physician of the god, and then came to Indra, and from Indra it has come to the earth by the sages, like his name was Bharadwaj. So if you read the Charak Samhita, which is about 5,000 years old, Susrut Samhita, you can find the descriptions of all herbs also, and the Panchkarma also into that. As far as naturopathy is concerned, you see, naturopathy, whatever the principles in other system of medicine, even in homeopathy, in naturopathy, in Siddha system of medicine, in Unani system of medicine, you can find all these kind of principles or all these kind of their fundamentals, they are already present in Ayurveda. The history of naturopathy, it started in the West, in the Europe, in Germany, in the late 1800. And I think his name was the Benedict Lust, who propagated the naturopathy and all that. But the principles of naturopathy, the principles of homeopathy also, which also came in the late 1800, is also present in Ayurveda. I can give you the simple examples. No, you see, naturopathy is what naturopathy is saying. Naturopathy is saying that main principle is that your body have an inherent tendency and have a lot of capacity to heal yourself from inside. You don't need a doctor from outside.
Correct.
Doctor can facilitate the healing, but your body has that intense strength which really can heal yourself. That's what the naturopathy says. Same, if you talk about the philosophy, there are 6 philosophical systems like Sankhya philosophy, Nyaya, Vaisesik, Yoga, all that. There is a theory is called Swabhava Paramvar. And what this theory says that there is spontaneous healing in the body. You don't need every time a doctor. So body has capacity. So same principle. It has been described in
naturopathy talk about? How does he tell you? If body is healing, what does he tell you to do? What does natural therapy consist of?
Yeah. So natural therapy, they say that, for example, they say that like the acute diseases, they also say that body will heal itself. The healing, that is the response of the infection of the disease, no? Because they have a theory of like Ayurveda that the disease is not created by the bacteria or germs. It is created by the morbid matter. In Ayurveda, we call that ama, the toxicity. And that is responsible for creating the disease. What naturopathy says, naturopathy uses some natural things. Actually, it is a drugless medicine. But now we are also using the same kind of herbs which we are using in Ayurveda, also used in the naturopathy. But they have using other things like water, sun therapy, and different color therapy, mud therapy, most of the natural therapy. And they say that basically what we are doing, we are facilitating the healing from outside. Because naturopathy teaches, even in naturopathy, they say doctor is a teacher. They teaches you how to live healthy. They will enrich your knowledge in the particular situation, how you can improve your health when you are suffering from this kind of problem. So naturopathy in itself is a very using the natural things, which is very close to Ayurveda. So many principles of naturopathy are also used in Ayurveda. But if you talk separately about the naturopathy, we can say most of the time they are not using the drugs. They are using different kind of mud therapies, different kind of steam therapies, what we call sauna, dry heat or wet heat.
Okay.
But they are also, yeah, you want to say something?
Have you, Ayurvedic doctor or Ayurveda over the years, thousands of years, have you incorporated any new ideas, or you are just following the old ideas by Shusharat or Charaka or Sage Bhagavat? These are the 3 great people who started Ayurveda, right? Or who have
Correct,
contributed to Ayurveda.
yeah.
So have you added on anything new?
Yeah, okay. So definitely these Sushrut, Charak Samhita and Vagbhat, they are the main treatise which most of the Ayurvedic doctors they are following. And now your question is that whether we have added something new into that or not. So you see, after the Charak, Sushrut and Samhita, in 16th century, in 17th, there another books comes like Madhav Nidan, Yoga Ratnakar, they have added. You cannot find the examination of pulse in the Charak and Sushrut. You will be surprised. It is not described in Charak Samhita and Sushrut Samhita. It is very late. In 1600, Yoga Ratnakar came and then they discussed about and they talked about the Yoga pulse examinations. So what I mean to say that always there is some addition. As far as the present situation is concerned, definitely the Central Council of Indian Medicine and Central Council for Ayurveda and Siddha research organization, they are doing a lot of researches, and these researches are coming up, and we are using the same herbs in some other disorders also, and having some sort of using them as a evidence-based medicine. Like for example, I will give you an example, like a very common medicine which is used as an aphrodisiac. As an aphrodisiac, Mucuna prurens. It is called Mucuna prurens. It is a powder of an herb which is used mainly as aphrodisiac to increase the male sexual power. But it is found that in the researches later on now, that if you are giving this to the person, it can increase the dopamine in your brain. And now this medicine is also people are using in the patients suffering from Parkinson's disease. We are using in that. At the same time, because it is a aphrodisiac, it is a good aphrodisiac in nature, it can energize your body, it can give you strength. Another use of this medication, the physicians are also using for the depression, for the anxiety. Also, it is used for to increase the sexual potency. So, by these kind of researches, we are trying to find out, the researchers are trying to find out that in what other situations these medicines can be used. So, this is an ongoing process, and it is always a question. People ask questions that there is lack of scientific evidence, or the researches in Ayurveda is not going as in modern medicine. I can say it is not as much as in modern medicine, but the process is going on, and people are trying to find out the evidences for that. So this is an
I have
ongoing
many
process.
questions
Maybe after
left,
yeah.
but time is running short. So I think Narayan wants to ask a question.
I'm telling you one of my experience. 6 years ago, in 2015, I was unable to sit even for 15 minutes. I was sitting on the tire tube. So I visited one Vaidya. I think you have heard the name of Sushil Vaidya in Jaipur.
Okay.
So उसने मेरे को लिटा दिया और लिटा के मेरे को चश्मा उतरवा के उसने मेरे पेट में एक नस को दबाया साइड में, और फिर मेरे को बोलता है कि अभी आप ये न्यूज़पेपर पढ़ के दिखाओ। तो मैंने बोला मेरे को दर्द पीठ में है, बराबर, और तो चश्मा उतरवा के मैं से न्यूज़पेपर पढ़वाऊंगा। उसने बोला नहीं, अभी आप बिना चश्मे के मैंने उसको पढ़ के बताया। बोलता है यू आर ओके नाउ, सेकंड सिटिंग आफ्टर 3 years। तो मेरे को समझ में नहीं है कि he was the नारी वैद्य और वैद्य, तो उसके बोर्ड पे आयुर्वेदिक चारे भी लिखा हुआ था। He has Ayurvedic books also, and he was not charging a single penny fees from anybody. मैंने उसका बाद में बाबा रामदेव से पूछा तो बोले my guru in the वनस्पति चारे। लेकिन मेरे को आश्चर्य हुआ कि दर्द मेरे को पीठ में था। I was unable to sit. नस यहाँ की दवाई, और उसके बाद मैं अभी 6 घंटा 8 घंटा भी बैठ सकता हूँ आराम से, 12 घंटा भी बैठ सकता हूँ एक सिंगल।
Yeah. You see, there are many therapies, and you see, you can understand. It is not that everyone is described in Charaka and Sushrut, but if you talk about the marmas, no, like what you are saying, that can be correlated. It is because of he might have some sort of practice to press that particular marma, which can, you see, marma therapy is nowadays is also getting popularized, and in South India, people are practicing it. Now in North also, people are doing it. So that may be because of the impact on the particular marma which gave you the relief. So it can be a part of marma therapy. But if you go to the classical description of the marmas in Charak and Sushrut, you will not find them as a point of treatment. They have been just described as to know about the severity of the disease. Only you can understand by pressing that marma, or if any kind of injury and trauma happens to that particular marma, then how your life will be affected. That tells about that. So it tells about the prognosis, it tells about the severity, but not described as a treatment method.
But now many people are treating through marm. It is like you can compare it like acupressure, a kind of acupressure. So marmas are the energy point. These are the points in the body which has special energy. And many doctor, he can be a special Ayurvedic doctor who has a kind of expertise in marma therapy. What we understand, probably he pressed your marma and you got benefit,
Relief, yeah.
you got relief, and then also this also enhanced your mental power, your confidence, and many things which are related to our mind. If we can control our mind, if we can understand, okay, probably this also gives you confidence and you will also try to improve yourself. So there are multiple factors, and I'm very happy that you had this good experience. So many people are treating traditionally also, and this is very common in South India and in Jaipur also very good weather. So it is good, but it is not a common practice. Marma science is not a common practice. Ayurvedic doctor, each and every doctor does not practice marma therapy. As Dr. Ravindra told you, in the Sushrut Samhita, there are 107 marma points. But there is a saying that you should protect these marma points and you should not injure these marma points, because if person press these points correctly, it can give you benefit. But if these points will be pressed wrongly, then they have harm also. So this
True.
is about the marma science or marma therapy.
Very true. Naranji, we have time or no?
We
Do we have
have
5 minutes or no?
5 minutes of all.
5 minutes. Okay, I'll ask last questions. Now, according to your experience, there are many therapies available today, like color therapy, hypnotherapy, body talk, and mindscape, and homeopathy, acupressure, as you said. What do you think? And color therapy is also there now. So, what do you think is more important? I mean, how can you grade it? Is Ayurveda more beneficial to these or long lasting? Does it have more depth of address or cure than these things that have come out recently today?
You see, whatever the therapies like you have told about the hypnotherapy, color therapy, and all that, this is all good because they all are non-invasive, no? Non-invasive. So if people are practicing and combining so many treatments together, I don't think there will be any contraindication and any interaction. So people will get more and more benefit by using these kind of non-invasive therapies. As far as Ayurveda is concerned, no. So we have a particular protocol to treat the person. As I have said, that Ausadi, Ahar, and Bihar, these are the three important things which we decide that how we can treat the patients. But along with that, definitely, if somebody can go for the chromotherapy, color therapy, and want to use the hypnosis, that can definitely add some sort of synergistic action for improving the
would you have a percentage
patient.
if Ayurveda is preventive or curative?
You see, Ayurveda is preventive as well as curative. But when we say the first and important thing is Ayurveda gives more emphasis on prevention.
Okay.
So that is the objective of Ayurveda. Swasthasya swasthya rakshanam. That is the first thing. How you can maintain your health, how you can preserve your health. And aturasya vikara prashamnam. This is the second aspect.
But the problem is people come to Ayurveda only when they are fallen sick. They never come to Ayurveda otherwise.
Yeah.
They are so used to taking shots and injections and pills that
You
kill.
see, early diagnosis. You see,
so isn't it too late then for curative? If somebody is
we
already sick
need to be very
stomach, then what happens?
definitely.
We need more awareness. If we will be more aware, if in the family we can tell our children how from the beginning they can be careful, how they can use principles of Ayurveda, they will stay healthy. And if there is any possibility of disease because of genetic reason or so, it can be delayed or maybe prevented. So it requires more education, more awareness, because why you want to fall sick? It is always good to stay healthy and to enjoy life.
Correct.
No, if the body is not healthy, even if you have best thing in your life, you cannot enjoy them. But
Correct.
the they should be taught from the beginning, from the childhood.
But what are
So
your
it is,
main features? What features would you tell the youngster to follow? Are there any bullet points, 5, 10, 20,
yeah,
I mean, that they should follow
yeah.
as a preventive measure?
You see, in a nutshell, Charaka says that how you're using your intellect. No, three things are very important in life: the patience, dhriti, the is buddhi, the intellect, dhriti is the patience, and smriti is the memory. If you are correctly using all these three things together, your intellect, your patience, and memory in a very proper way, there will be least chances to get sick, because when there is some derangement of all these three, you do some sort of unwanted, you follow something of unwanted diet, unwanted lifestyle, unwanted actions in your life, which makes you sick. So for to become to keep yourself healthy, diet is the first, then second comes the lifestyle. If you are following diet and lifestyle, that is so beautifully described in Ayurveda, how your daily routine should be, what sort of routine you should be according to the seasons and in the night. If you are following all those routines very properly, there are least chances that you will get sick.
Okay, good. Now we'll end the show. I just want to tell you a joke. You told that we should live for 100 years. I went to meet a senior citizen, friend of mine, and he said, "Why are you cursing me?" I said, "Why? What's the problem?" "I don't want to live so long," he said. I said, "Why? What for?" Saying, Buddha, Hikri, very first, banks are not giving enough interest. So all my money is being wasted. I have no earning. And there is so much inflation. By the time I reach 80, all my money will go. Then what am I going to do? So anyway, it's just a joke. I mean, this is how many
But
people feel nowadays. That with the economic conditions, there's a negative stand in people. Because really, senior citizens have a hard time living.
yeah, but this is the most cherished desire of the human being, to live for 100 years.
That is true, but if you don't have money, then it becomes a
With
problem.
the
You have
sensory
money,
organs
so you
working.
have to, with health, you need wealth also.
True, true. So
It takes
that
a both.
requires a planning. If a person will use the mind carefully, as
Because,
Dr. Ravindra told,
yeah,
mind, body, everything is important.
exactly.
So if from the beginning a person is understanding how to live a life, if they plan their life, then it will not be a problem. They can live 100 years, but also with the good health. When your
Exactly.
eyes can see, when you can hear, when you can enjoy your food, when you can have a beautiful life, when you
True.
can laugh, when you can smile. So certainly it requires planning. Also, it requires good friends. So it's a special platform you are
You
gathering
need,
together.
you need good
It is
karma
so
also.
important.
You need good karma also for that.
Yes,
Because
yes. That is always important.
without too much
Ayurveda
wealth,
believes in that. Yeah,
health,
karmas are also
if
important.
you have health and you do not have wealth, you will become sick.
Yeah.
There's a tendency for that. So combination of both. So anyway,
Yes,
I
correct.
think I would like to continue this session next time. We'll arrange
Okay.
one more uh, one Monday for you guys to
Thank
complete the
you.
topic. I have so many other questions lined up which I could not ask you today. So we'll
Okay.
just end the
Next
show with
time.
a lot of thanks to you and Pratibha. I hope you're enjoying editing my book. You- Are you? Huh?
I
I'm
am so
writing a
happy.
book
I am
called
so happy that
Timeless
I can
Ancient
do that.
Remedies. I've given to
Yeah.
Pratibha to edit that. So it'll be out in the market after 6 months. So it's very good. It comprises the complete how to handle earth, air, water, fire elements within our body, including
Yeah.
ether. So it's done a lot of research on that, and I've given to them to edit. So thank you very much once again.
You're welcome.
Thank you all.
You're
It is
welcome.
so nice
It
to
was so
talk with all
lovely
of you.
because
Thank you so
Beautiful
much.
gathering.
Namaste.
Thank
and
you.
Beautiful
probably we'll
people.
invite you as guest of honor next time for you to tell about your philosophies or your curative procedures. Yeah. So both
Yeah,
of you come later on in Feb or March.
sure.
Right.
Okay, sure.
I will let Narayan to take over.
Thank you.
Thank you to all participants and our guest. Now, in conclusion, the आयुर्वेद जेका आहे उहा असांजो हिकिड़ो प्राचीन इलाज जी पद्धति आहे ऐं आई थिंक मोहन जे दड़ो जेका असांजी सिंधी संस्कृति आहे उन में बि आयुर्वेदिक जो उल्लेख आहे इन मोहन जो दड़ो संस्कृति आयुर्वेदिc is also mentioned because some sorts of they got instruments and with the city planning and everything. So I think it is oldest paddhati for the curation of the body. It's Ayurvedic. Asa unaki ॿिए दफ़े कंटिन्यू कंदासीं. I'm thankful to Dr. Ravindra Mamgain, Dr. Prathibha Mamgain, and our Diva Chugani, Malini Hemlani, and Dada Dayal Harjani. They have taken their time and done this beautiful episode. And last, we end this episode. Before I end this episode, one small pratna. हे भगवान असां सभिनीनि खे सुबुद्धि दे, शक्ति दे, निरोगता दे, पंहिंजो पंहिंजो कर्तव्य पालन करे सदा सुखी रहो। हे भगवान हम सबको सुबुद्धि दो, शक्ति दो, निरोगता दो, अपना अपना कर्तव्य पालन करके सदा सुखी रहे। हरिओम, शांति शांति शांति। मिलेंगे जल्दी ही एक नेक्स्ट एपिसोड में। सबको जय झूलेलाल, ओम शांति।